Okay, and the final item of business this evening is a members' business debate on motion 17320 in the name of Ros McCall on Mental Health Awareness Week 2025. The debate will be concluded without any questions being put. I'd invite members wishing to participate to press the request to speak buttons, and I invite Ros McCall to open the debate around 7 minutes. Ms McCall.
Thank you, Deputy Presiding Officer. I'm pleased to be using members' business time this evening to debate what is an ever-growing and increasingly urgent issue within our society. I'd also like to thank members from across the Chamber for supporting this motion and enabling us to discuss these matters today. As mentioned in the motion, Mental Health Awareness Week runs from the 12th to the 18th of May, and I welcome the vital work undertaken by the Mental Health Foundation in driving this annual campaign. This year's theme is community, reminding us of something profoundly important: the simple human need to feel connected, to know you belong, and to understand that however difficult the circumstances, you are not alone. We all recognise the value of strong, supportive communities and meaningful connections to other people. And for those living with mental health challenges, that sense of belonging can be quite literally life-saving. But while awareness campaigns are valuable, the truth is that without adequate services to back them up, those affected are being left behind. And this evening, I want to focus my remarks on the state of mental health provision in Scotland today for both adults and children, and to raise serious concerns about underfunding, service cuts and a lack of coherent joined-up provision, particularly in the region of Mid-Scotland and Fife, which I'm proud to represent. So let me begin by children's mental health and early years support, an area which, as members know, is a particular passion of mine. There remains a significant gap in provision for children in primary schools. While funding exists for counselling services in secondary schools and children aged over 10 within primary schools, there is no equivalent therapeutic mental health service support available for children under that age. And yet the Scottish Government's own pandemic wellbeing study showed that almost 20% of 5 to 7-year-olds were already experiencing mental health difficulties, a figure that rose to 23% of 8 to 11-year-olds. These are our youngest children, and almost a quarter of them are struggling before they even reach secondary school. 1 in 4 children are experiencing mental health difficulties by the age of 11, and the Scottish Government's existing provision is quite simply too little, too late. Evidence from Place to Be could not be clearer. Their services show that one-to-one counselling in primary schools makes a measurable difference, with 75% of primary school children reporting improved mental health outcomes, alongside better classroom learning for 55% of children and improved behaviour of up to 57% of pupils. We recognise the importance of early interventions in almost every other area of public policy. So why is mental health of our youngest children still being treated as an afterthought? The outcomes are obvious, the benefits are clear, and it is utterly unacceptable that in 2025 we're still failing to act. Turning to adult mental health provision, the picture is equally concerning. In their briefing for tonight's debate, Sam H highlighted that the number of people in Scotland reporting a mental health problem has more than doubled since 2011. That's up from 4.4% to 11.3% in the most recent census. Even more harrowing is the rise in probable suicide deaths, which has increased again last year to 792 lives lost. Statutory mental health services are stretched to breaking point. For too many people, these services, despite being under-resourced and overburdened, remain the only available support when they reach crisis. That is why it was so deeply disappointing that the Scottish Government abandoned its 2021 commitment for every GP practice to have access to a multidisciplinary mental health and wellbeing service. Primary care access to mental health support is essential. It's the front line of early help and prevention. And withdrawing that commitment has left countless people facing delays, deterioration, and in some cases, tragic outcomes. Presiding Officer, there are also a vital, often overlooked dimension of mental health provision that I also want to address tonight. Too often when we discuss mental health, we forget the devastating psychological impact of certain physical health conditions. And I want to highlight 2 in particular: stroke and Huntington's disease. As the Deputy Convener of the Cross-Party Group on Stroke, I have heard all too often the profound life-altering impact stroke can have on mental health. The Stroke Association's latest figures in my region, 3 health boards, show that 70 to 75% of people who suffer a stroke in 2023 were likely to experience mental health issues. That correlates with the UK-wide research back from 2019, which found that 3/4 of stroke survivors experience mental health difficulties ranging from loss of confidence, anxiety, depression and, tragically, suicidal thoughts. A stroke is not only a physical event, it changes every aspect of a person's life, their independence, their relationships, their employment, their sense of self. And yet psychological aftercare is patchy at best. While the Scottish Government's 2023 Stroke Improvement Plan rightly identified psychological care as a priority, the delivery of that care remains shockingly poor. Measured against the standard red, amber, green ranking, most health boards remain stubbornly in the red or amber categories, and that's simply unacceptable. I also want to highlight Huntington's disease, a rare but cruel genetic condition that devastates families, affecting people physically, cognitively and mentally. Scotland is believed to have one of the highest rates of Huntington disease in the world, Presiding Officer. And yet, despite this, some integrated joint boards are now proposing to cut funding for the Scottish Huntington Association, which would effectively end specialist hunting disease support services in those areas. That decision would not only be heartless, it would be a dereliction of duty. I hope the Minister will take the opportunity tonight to join with me in opposing these cuts and commit to ensuring families affected with Huntington's disease in Scotland receive the support, including specialist mental health care, that they so desperately need. So, in conclusion, I want to applaud the incredible work of the Mental Health Foundation, SAMH, Place to Be, See and the many other charities, organisations and grassroots groups that work tirelessly to raise awareness and provide services where the state so often falls short. Support at the right time, particularly through early intervention, transforms outcomes, and I urge the Scottish Government, not for the first time, to take responsibility for this issue once and for all. Our communities deserve better, our children deserve better, stroke survivors and families living with Huntington's disease deserve better, and our mental health services staff and those they serve cannot wait any longer.
Thank you. We now move to the open debate. I call first Christine Graham, to be followed by Pam Goethel. In 4 minutes, Ms. Graham.
Thank you very much, Deputy Presiding Officer. I congratulate the member on securing this debate. Today, issues with our mental health or well-being are recognised as having a status, a significance, equivalent to physical illnesses, and that, of course, was not always the case. I'm not referring back to the bad old days of asylums, which isn't so long ago, but an acceptance now generally that it's not a weakness or an embarrassment to admit to or recognise if your mental health is not in a good place. That change will have contributed to more identifying as having mental health issues. COVID must also have exacerbated the mental well-being of many people, perhaps due to isolation, illness, loss of a loved one, financial worries and indeed combinations of any of these. For the young, there are the pressures of social media. How do your looks conform to fashion? Are you too fat? Bullying follows you into your bedroom and is at your fingertips in the ever-present social media. For the single parent, money worries. For the pensioner, money pressures, loneliness, failing health, mobility limitations, family far removed, perhaps even estranged. That's just some examples. So how to cope, where to find support, and I accept there are huge pressures across all age ranges for which I do not have solutions. But there are well-known agencies such as the CAB for debt support, bereavement services run by the NHS and Samaritans, and more localised help such as, for example, one I didn't know about, the Scottish Borders Widowed Community, which is a peer-to-peer support group for men and women in the Scottish Borders who've lost a partner, offering a mix of private online discussions, in-person Widows' Hope meetings in Galashiels and social activities, giving widowed people a chance to give and receive support through their grief in a trusted, safe space, as well as making friends and combating social isolation and loneliness. It has been described by its members as a lifeline, being the only group in this area that is exclusively for widowed people, and I quote, "I joined the group in 2023, 5 weeks after I lost my husband Sean. Losing Sean so suddenly and unexpectedly was devastating to me, but the Scottish Borders Widows community gave me hope for the future and brought me so much joy." Close quotes. Being widowed is very different from other losses and is widely recognised as one of the most traumatising and stressful life events. Therefore, having access to this kind of support locally is crucial to the health and well-being of the members. There's also an online service called Together All for residents in the Borders aged 16 and over. That provides an anonymous peer-to-peer forum offering self-assessment for anxiety and depression. There's a 24-hour service for online chat with wellbeing advisors to support people maintain their mental health and well-being. There are What Matters hubs offering drop-in sessions across the borders. And if I look across to my other part of the constituency, we're all aware of men's sheds. In Penicuik, for example, bringing men together to chat, take them away from their isolation once they're no longer working in teams. They make useful items such as the bench and bird table for Broomhill Day Centre. And that centre too provides support for elderly people away from loneliness and isolation. Not just lunches, but company and a chat. There's the Kellogg Club at North Kirkchurch, Penicuik, not easy to say, where men meet for an afternoon tea and chat and have a speaker. I was one such, I think, at their inaugural meeting. I introduced myself with the words, "Is this where the speed dating takes place?" It more than broke the ice, but disappointingly, I'm still unattached, and I'll leave it at that. There are many more examples supporting those suffering, and I know members will wear this: baby loss, suicidal thoughts, drug and alcohol addictions. I know many of them across the borders. There's too many to mention, but I know who they are, and I thank them, and they do much to help people through the mental stresses they meet in today's modern world. Thank you.
Thank you, Ms Graham. I now call Pam Gosal to be followed by Paul Sweeney, around 4 minutes. Ms Gosal.
Thank you, Presiding Officer. I would like to start with thanking my colleague Ros McCall for securing a member's business on such an important topic. As we approach Mental Health Awareness Week, occurring between 12 and the 18th of May 2025, we need to take a step back and reflect on how mental health truly affects people across Scotland. So many individuals suffer from mental health challenges that make their lives hard for them, both at work and in relationships. Recent insights from Public Health Scotland show that mental health referrals have shot up to 22% in just a year. It is alarming to see that over a third of all GP visits are now related to mental health concerns. This becomes even more concerning as the Scottish Health Survey states that 1 in 4 adults in Scotland face mental health issues, an increase that can't be ignored. The rise is anxiety, depression and stress is striking and points to an urgent need for ongoing support and intervention. Presiding Officer, while I share these serious concerns about mental health within our communities, I also want to shine a light on some of the remarkable efforts taking place in my region of West Scotland. Initiatives like Men's Sheds in Milngavie, Bearsden and Kirkintilloch focus on loneliness, mental health, depression, alleviation through community-focused projects. Fact in Bishopbriggs that works to build a stronger community and providing mental health support by breaking down social isolation. The East Dumbartonshire Association of Mental Health offers mental health and wellbeing support on an individual or peer-supported basis. And Grace in Kirkintilloch supports mental health through peer support groups focusing on stability, hope and confidence for the future. I would encourage everyone to please visit them in the Parliament this week as they are hosting an exhibition in the Garden Lobby. There are so many great organisations in my region and all across Scotland that are doing a fantastic job, and I would today like to thank them all. Unfortunately, due to time, I cannot mention them all today. And finally, I would like to discuss how people from BAME backgrounds see mental health. Within some of these communities, it is a taboo to discuss mental health. which is seen as a sign of weakness. This stigma stops people from getting the treatment that they need, leading to further isolation and suffering. The Mental Health Equality Evidence Report highlights that BAME individuals are less likely to access mental health services and are more likely to face poor mental health outcomes. The rates of delayed discharge among BAME patients in mental health specialities are significantly higher than for the general population. We must work to dismantle these barriers and foster an environment where conversations about mental health are encouraged and supported. And one organisation I was fortunate enough to meet was the Scottish Asian Counselling Service, who work with the people of South Asian descent as well as other BAME communities. Since 2023, they have delivered 180 counselling sessions to 30 individuals, including children, young people and adults, delivered workshops and collaborated actively with Sikh and Muslim communities, visiting gurdwaras and mosques, and have created a monthly online drop-in platform supporting open conversations around mental health. To tackle these mental health disparities in BAME communities, we need a comprehensive approach. We must work on breaking down cultural stigmas, improving accessibility to services, addressing socio-economic barriers and providing care that respects cultural sensitivities. By fostering strong communities and investing in targeted support, we must make a real difference in mental health outcomes for BAME individuals in Scotland. Presiding Officer, I look forward to the Minister's closing response and how the Scottish Government will tackle these issues that I have mentioned today on mental health.
Thank you very much. And I call Paul Sweeney to be followed by Gillian Mackay. Around 4 minutes. Mr Sweeney.
Thank you, Deputy Presiding Officer, and I would like to thank Ros McCall as well, the Conservative member for Mid Scotland and Fife Region, for securing this important motion for members' business, which I was pleased to sign and support. Mental Health Awareness Week is an important time in the calendar where we recognise the important advances that we have made in raising awareness of mental health, while also acknowledging that we as a nation still have a long way to go to achieve a society and economy that promotes good mental health. This year's Mental Health Awareness Week's theme is community, and it aims to recognise the role that community resilience plays in providing a positive environment for good mental health to take root. Yet across Scotland, we see community mental health services being stretched to breaking point, with punishing cuts taking place from Aberdeenshire to Dumfries and Galloway, leading to vital services being cut, if not closed completely. And in my home city of Glasgow, these cuts have been particularly brutal this year. In an age where increasing awareness of mental health enjoys cross-party consensus, it's all the more incredible that Glasgow's Health and Social Care Partnership has cut their funding of Flourish House, a groundbreaking mental health recovery community based in the Woodlands district since 1997. And it's the last remaining example in Scotland of the clubhouse model. It's not just Flourish House facing an uncertain future. Glasgow's Notre Dame Children's Centre, the Sandiford Clinic's counselling service for survivors of sexual assault, and even the Scottish Huntington's Association's Huntington's Disease Specialist Services are all in danger of being closed due to funding cuts. This means that while we in Parliament celebrate rightly the importance of community groups in providing good mental health, the same community groups in Glasgow and elsewhere in Scotland are now deeply worried about their future. According to research by See Me Scotland, 60% of Scots surveyed think that there is still a great deal or a fair amount of shame associated with mental illness. And I'm sure everyone in this Parliament will agree that that's simply unacceptable. Yet this Mental Health Awareness Week, we need to recognise that if we want to lift the shame of mental illness, we need to be willing to finance the services that provide help for those who are brave enough to ask for help. It's not good enough to say it's okay to not be okay. It is the duty of all those elected to Parliament to support these services which are critical, and we must work together to end these cruel cuts across Scotland to mental health services and instead create a process that will guarantee the long-term funding of such vital support. Government at all levels must be reprogrammed to prioritise long-term value creation over short-term cost savings. Deputy Presiding Officer, I want to thank Ms McCall for tabling this motion on a topic that I am passionate about, and I want to congratulate the Mental Health Foundation for their persistent work to raise Scotland's awareness of mental health. And I hope that this debate will play an important role in both raising awareness of mental health and the importance of properly funding community-based mental health services, as well as dealing with those critical triggers and causes of mental ill health at all stages of life. We all need to play our part in securing better support for those suffering with poor mental health in Scotland, dealing with the root causes, and for that reason, I'm very happy to support this motion and its focus on community resilience. Thank you.
Thank you, Mr Sweeney. I now call Gillian Mackay to be followed by Brian Whittle, allowing 4 minutes. Ms Mackay.
Thanks, Deputy Presiding Officer. I also wish to extend my gratitude to Ros McCall for bringing this debate forward. Since 2001, Mental Health Awareness Week has marked a time to challenge stigma and push for action. Led by the Mental Health Foundation, it's helped to raise awareness and advocate for meaningful change. As colleagues before me have pointed out, this year from the 12th to the 18th of May, the theme is community, and it serves as an important reminder of how connection, belonging and mutual support can strengthen mental well-being. Community is not just about where we live, but also about feeling supported and valued by those around us, and remind us that we are not alone. We know that in Scotland, there is some way to go to improve mental health support. As Sam H points out, while the Scottish Government's mental health and wellbeing strategy rightly emphasises early intervention and prevention, the reality on the ground is that access to local services remains inconsistent. Too many people can only access help once they've reached crisis point, and statutory services designed to support the most complex needs are overwhelmed. The number of people reporting a mental health problem has more than doubled since 2011, with 11.3% of people saying that they had a mental health problem in the 2022 census, compared with 4.4% in 2011. In a way, this should absolutely be welcomed. People recognising that they are struggling is a hugely important part of raising awareness and tackling stigma. Primary care remains a crucial route for accessing mental health support. Sam H welcomes the increase in the primary care mental health workforce, with 356 new full-time equivalent posts funded through Action 15 of the Mental Health Strategy. But community link workers were meant to be a core part of these services. They play an essential role in helping people access wider community support and address the underlying causes of their distress. Important work continues to be needed, such as committing to long-term multi-year funding for community link worker provision across the country, and to continue working with partners to standardise the community link worker role. There is also urgent action needed from the Scottish Government to work with IJBs, local authorities and health boards to ensure community mental health provision is maintained and sustainably funded to meet the needs of our communities. I also want to turn the attention to the challenges the system faces in meeting diverse needs across the population. Services that were designed for people with severe mental illness, such as schizophrenia or bipolar disorder, are now also expected to handle rising demand for neurodevelopmental condition assessments, like autism and ADHD, which affect around 1 in 10 people. We're seeing some of these pathways removed around the country for those with autism and ADHD diagnosis needs. I mentioned during the Programme for Government debate that while we should be supporting workplaces and education settings to put in place support regardless of people's diagnosis, we can't rely on these settings to do the right thing. We also cannot underestimate the positive impact that a diagnosis for some can have, and where we've lost these pathways, we need to see them reinstated. Organisations such as CME highlight that the research clearly demonstrates the need for ongoing investment and a sustained focus on addressing stigma and discrimination in Scotland, especially in terms of how they affect the experiences and outcomes of people living with a mental illness. They also underline the scale of the challenge ahead and the transformative change required to meaningfully reduce stigma and discrimination. Finally, the importance of community also extends to recognising the impact on carers and families. The Scottish Huntington's Association have shared powerful examples, with many across the chamber, I'm sure. This condition affects physical, cognitive and mental health and places enormous strain on family members who provide care. For 35 years, families in Scotland have been supported by Huntington's disease specialists from the Scottish Huntington's Association. This proactive, community-based support has been shown to prevent crises and reduce hospital admissions, precisely the kind of service that we should be protecting. Despite this, we're seeing the services potentially being cut, and we need to see the government work with those IJBs. I also wanted to briefly echo Ros McCall's comments on the psychological support for stroke. Some of those we've heard at the cross-party group on stroke have described how post-stroke survivors found themselves not only coming to terms with their life now, but also for some disliking pastimes and even food they used to like. Families finding themselves coming to terms with a new person that has come home post-stroke, and the Stroke Association has a brilliant report on this if anybody wants to see it. Awareness matters, but it's only the starting point, and to build a fairer system, we must listen to those directly affected and commit to creating services that are properly resourced, responsive and equitable. Thank you.
Thank you, Ms Mackay. We now come to the final speaker in the open debate, Brian Whittle, around 4 minutes, please.
Thank you, Deputy Presiding Officer. Can I also echo my thanks to my friend and colleague Ros McCall for bringing this debate to the Chamber ahead of Mental Health Awareness Week. Now, you'll not be surprised, Deputy Presiding Officer, to note the direction of travel I'm going to go in with this particular debate. I can also almost see your eyes rolling already, because on my wall in my office I have a poster that has been ever present that says, "Food is the most abused anxiety drug and exercise is the most underutilised antidepressant." And I take that with because really with the Mental Health Foundation, which it's now becoming quite an old report of theirs because I keep quoting it. It's called Food for Thought, and they discuss in that the importance of nutrition to our mental health, not just to our physical health. And it makes sense. Of course, it makes sense because the body, the brain is just an organ like any other organ in the body, and of course, so if we feed that properly, it's going to work better. And then we've got Sam H, who are great exponents of the need to be physically active in tackling poor mental health. And it's I always quote this, that they are the sponsors of Jog Scotland, and they don't do that just out of the goodness of their heart. They do that because they're trying to promote an active lifestyle in terms of tackling poor mental health. So the access to physical activity is important, and I was really pleased to hear Christine Graham talk about social media, the impact of social media and the ever omnipresent mobile phone. So we have to give our I would say our youth primarily the opportunity to disconnect from social media, to disconnect from their mobile phone. And I have to say, I haven't seen too many kids running about a hockey pitch or a netball pitch or a football pitch carrying their mobile phone. And it's that ability to disconnect, to not have to worry about what our peers are saying about us on social media for that period of time, that allows that anxiety, it allows us to that outlet for the anxiety, that outlet for energy. And this is why I will continue to promote in here the need to be physically active, the need for sport and music and art and drama to be available in our schools. And our schools, for me, are such a battleground when it comes to tackling health problems, poor mental health, because what we're trying to tackle in our schools is poor mental health, it's poor physical health, it's attainment, it's poor behaviour. And in that, I would suggest to you that again, I'm going back to this, a good diet and being physically active tackles that better than just about anything else that we can do. I was really interested in just to hear Ros McCall talk about the plight of potential of stroke victims. And I wanted to highlight some really good practice in Kilmarnock with the Kelly Heartmates, who I visited not that long ago again. Now, when you have a stroke, you have something like 6 weeks rehabilitation in a hospital. Then after that, you're kind of left to your own devices. And when I was speaking to the people that go along to Kelly Heartmates, they talked about this going home and almost waiting for their next stroke, frightened about their next stroke. Well, what Kelly Heartmates did was put together an exercise programme for people that have suffered stroke, and that is supported by stroke physiotherapists from Kilmarnock Hospital. And I went along, and let me tell you, I got a fair sweat up myself, but the reality is the most important part of that is the community, is that after the exercise class, it's a cup of tea and a biscuit and a chat, and that is unbelievably important. So for me, the 3 pillars, I could talk about this all day, as you well know, Deputy Presiding Officer. The 3 pillars: good nutrition, physical activity, inclusivity into our communities. And if we can tackle that, then perhaps we get away from this this need to increase capacity, because we're always behind the curve and always playing catch-up, which is unsustainable, or we can work on reducing the need. Deputy Presiding Officer.
Thank you, Mr Whittle. I think it takes less and less to get a big sweat up these days. I now invite Marie Todd to respond to the debate. Minister, around 7 minutes, please.
Well, I can certainly empathise with that sentiment, Presiding Officer. I'd like to start by thanking Ros McCall for putting forward this year's motion. The theme, community, is a great one. And I've spoken before about how community-based supports, including from the third sector, are a vital part of our mental health system. It's reflected in our mental health and wellbeing strategy, which outlines a long-term vision of a Scotland that's free from stigma and inequality, where everyone achieves the best mental health and wellbeing possible. It addresses a range of needs to ensure that people get the right support whilst focusing on the wider social and economic factors that can impact people's mental health. This Mental Health Awareness Week, Scottish Government will be raising awareness in a number of ways, and I'm looking forward to visiting Gairloch Museum in my own constituency, which runs weekly activity sessions for unpaid carers and people living with dementia. This project is one of thousands of projects that have received funding from our community's Mental Health and Wellbeing Fund for Adults. Since 2021, the fund's provided £66 million to grassroots groups across Scotland, supporting those at risk, most at risk of poor mental health. Likewise, since 2020, the Children and Young People's Community Fund has provided local authorities with over £65 million funding, over 300 community mental health and wellbeing supports and services. Certainly.
Ros McCall.
I do thank the Minister for taking this intervention, and we are looking at young people. I was wondering if the Minister would agree with me that, and with Place to Be, that actually we need to be doing more focused work in our schools when it comes to our young people, just to make sure that they have that early support and that early intervention, which will hopefully mean that they don't need the support as they grow older.
Minister.
So certainly, absolutely, I've met with Place to Be before, and they're a very impressive group of people, and as I say, the funding that we are providing to support communities is very much focused on early intervention and prevention, and on delivering tailored support to keep people mentally healthy. I've seen for myself the difference that these funds are making in people's lives. On a recent visit to Empower Women for Change in Glasgow, I saw how minority ethnic women are being supported to improve their mental health and wellbeing through shared learning and peer support. The inclusion of an adult fund in the Scottish Government's third sector fairer funding pilot will see multi-year funding for the first time, with £15 million being invested in each of the next 2 years. That will give community organisations the security to continue the great work that's being done across the country. We're also supporting a number of the other programmes across Scotland targeted at specific groups most at risk of poor mental health. That includes the National Rural Mental Health Forum, which provides tailored supports for rural and island communities and the unique challenges that they face. Another great example is Sam H's Changing Room Extra Time programme, which uses football to bring men together to talk about mental health, reducing stigma and isolation in the process. But not everyone is comfortable with face-to-face support, so we've also funded a range of online supports to provide mental health information and advice. These include the Mind to Mind and Parent Club websites for adults, and the iFeel and Mind Your Time resources for children and young people. In terms of specialist supports, I'm sure you'll all be aware that for the first time ever, national performance against the 18-week CAM standards been met, with over 90% of children and young people starting treatment within 18 weeks of referral. That's been achieved alongside increasing referrals to CAMS for support, and we remain committed to meeting that treatment time standard and clearing backlogs by December 25, ensuring that our young people receive appropriate mental health support quickly. I'll give way.
Brian Whittle, briefly.
I can thank the Minister for giving me, and she's detailing there how CAMS or the waiting time for CAMS are coming down. But we should also accept that too many children are falling into poor mental health, and actually Anxiety is a natural state, a natural part of life. It's because we're not giving them the outlet for that anxiety that's leading them on to the need for CAMHS.
Minister.
I'll certainly come on to that in a moment, but anxiety is a natural state, but it can be pathological, and there is no doubt that anxiety disorders cause an immense level of disability to those that suffer pathological anxiety. So I don't want to diminish the experience that some people have. But yes, we can do things to increase people's coping skills and resilience, and I'll come on to that before I finish. I want to recognise the significant increase in children and adults who are seeking support for their neurodivergence. Whilst that's challenged services, NHS boards and health and social care partnerships have to prioritise funding to ensure that those who need it most can access assessment. We fund the National Autism Implementation Team to support NHS boards to develop and to enhance and redesign local neurodevelopmental services. And I recognise, as my colleague Gillian Mackay says, that receiving a diagnosis can be important. However, a formal diagnosis should not always be needed to access support, and not all people with neurodivergent support needs will meet diagnostic thresholds. Such support should be made available for those that need it in their local community, whether that's in education, in employment or elsewhere. We're working across policy. Certainly.
Christine Graham.
It's actually not relevant to what the Minister is saying just now, but it's a plug for Trellis Scotland, which I failed to mention, which is gardening and horticulture, which is therapeutic for children and adults, because unlike Brian Whittle, I don't have running shoes, but I do have a fork and a spade.
I'm just glad you didn't raise it as a point of order, Ms Graham. Minister.
Let me assure the Chamber that between Christine Graham and Jim Fairley's efforts, I am well aware of that organisation's amazing work in horticulture and using horticulture as a therapy and a way of connection and improving mental well-being. So we're working right across policy and services to raise awareness and to ensure that people providing services are able to respond to the needs of neurodivergent people. We're also investing in our Autistic Adult Support Fund, which does also provide support to autistic adults without the need for a formal diagnosis. We've invested almost £250,000 in assessment and support for children, in addition to the significant investment across all the services that I've already mentioned. In raising awareness of mental health, it's also important that we raise awareness of suicide. We know that supporting people to talk openly about suicide saves lives. And last month saw the launch of the Suicide Prevention Scotland's powerful new campaign to reduce stigma and support anyone at risk or affected by suicide. I want to come on to Brian Whittle's point, because I smiled as he said I'm going to bore the Chamber. I thought he was going to talk only about exercise, which is a passion that we share. The evidence for exercise, both in treatment and in prevention, but also in treatment of mild to moderate mental illness, is growing. And the evidence that exercise is a solid investment for our children is huge. The Daily Mail evidence has shown that if you want your children to read and write better and want them to perform better at school, you need to get them moving. And I would commend that evidence to everyone in the Chamber. Sometimes mental health interventions don't look like mental health interventions, and the Daily Mail is one of them. I'm glad that a number of people mentioned the social determinants of ill health. We are seeing a rise in mental ill health at the moment, but that's on the back of 15 years of austerity, a pandemic, geopolitical forces, war, the discussion about tariffs and an immense cost of living crisis. So we have to recognise the social determinants of mental ill health. And I'm very proud to be part of a government that is tackling child poverty, and that will have a lasting benefit of the mental well-being of our population. In closing this debate, I want to emphasise that mental health and well-being remains a priority for this government, even in the context of the last few difficult financial years. The direct programme budget for mental health has more than doubled, and I'm grateful for the opportunity to draw attention to this in the Chamber today. Thank you to everyone who took part.
Thank you, Minister. That concludes the debate, and I close this meeting of Parliament.